During clinical sessions and urology meetings, we noticed that patients who had learning disabilities with testicular cancer, the discussions that we were having were taking longer, and that was to do with some of the challenges that arise as a result of their learning disabilities. For example, some patients we would find it much more difficult to image because to put them through a scanner you'd have to anaesthetize them, or obtaining the simplest things like blood samples or even consent for treatment. These are challenges that we were facing, and the postulation was at that point, are these patients surviving less than the patients that we treat without learning disabilities because of these challenges? And we looked into the literature, and there's a real paucity of data out there. So we analysed a 14-year cohort of patients with learning disabilities who had attended the outpatient setting or been admitted to hospital, and then identified those with testicular cancer and compared survival rates in those patients to the general population of patients with testicular cancer without learning disabilities, and there's a significant disparity in survival. Now, the reasons for this we haven't identified, and that's a larger piece of work that is forthcoming. But we, again, surmise that may be because of late presentation, because patients won't know to examine themselves, they won't know, they'd be educated about the signs and symptoms to look out for with cancer. There may be other issues, other factors associated with different types of cancers as well, with patients with learning difficulties, if we are to postulate that this problem is there for all cancers, and they may be things such as less access to national screening programs. Nevertheless, the finding is there that patients with testicular cancer and learning disabilities survive less than those without learning disabilities. And so I think that it's incumbent upon the medical fraternity to look into this and find the causes of that. The other issue that's important is that testicular cancer is a rare disease. People with learning disabilities constitute 1.5 million of our population in the UK. That's around 1 in 40 people have some level of learning disabilities. Now, they are living longer, and so cancer in these patients is becoming more of a problem. So the next piece of work that we're doing is looking at other cancers. If there's no biological reason why these testicular cancer patients should be surviving less from their testicular cancer, then the causes of that poorer survival may also be there for other cancer types. And I think that is much more of an issue for society as a whole. These are a vulnerable group in our society, and I think that more focus should be given to cancer in these patients. First is regarding education of patients, and I know that certain local health authorities in the UK have thought about this and they've implemented change, but I think the change that comes needs to be broader than that. The second issue is you can't really find a solution to a problem unless you know what the cause is, and I think that we do need to identify exactly what's causing this. Yes, we can address the problem of education, we can address outreach to these members of our society, to their carers. We can address attitudes of medical staff that may end up in perhaps some patients not receiving full dose chemotherapy, for example. I don't know the answer to these questions. That analysis needs to be done. But once we know, I think we can address the problem much more coherently. I think we need to empower the carers of patients with mental disabilities with knowledge. We need to educate them about symptoms from cancer, about signs to look out for, about examining the patient, for example. Many of these patients are washed by their carers, and so that's a perfect opportunity perhaps to look for any changes in their body habitus that may indicate they need to go and see a doctor. I think that's something that should be done. So I guess, in answer to your question, the healthcare professionals can educate patients, but also and carers, but also the carers themselves can educate themselves in order to be able to pick up signs and symptoms that need addressing.